Hyper IgM syndrome (HIGM) is an immunodeficiency disorder. But this picture shows that disease mechanisms detail going on. Introduction. Hyper IgM syndrome is a rare primary immunodeficiency disorder characterized by defective immune response. It affects the body's ability to produce certain types of antibodies, specifically switching from IgM immunoglobulin M to other immunoglobulin classes. As a result, patients have elevated level of IgM but lower levels of other immunoglobulins, leading to increased vulnerability to infections. A definition. Hyper IgM syndrome is a group of disorders where patients have normal or elevated levels of IgM but deficient levels of other immunoglobulin isotypes. This defects arises due to the inability of B cells to undergo class switch, recombination, a process needed to switch from producing IgM to other antibody types. Types of IgM. X-linked hyper IgM syndrome. The most common form caused by mutations in the CD40 ligand gene on the X chromosome. This type predominantly affects males. Autosomal recessive hyper IgM syndrome caused by mutations in different genes such as AID and UNG, which are responsible for class switch, recombination, and somatic hypermutation. Other rare forms caused by defects in CD40 gene itself or other signaling pathways involved in B cell activation. Causes hyper IgM syndrome result from genetic mutations that affects the introduction between T cells and B cells, which is necessary for the normal production of antibodies. The main causes are: 1. Mutation in the CD40L gene, most common in X-linked HIGM. 2. Mutation in AID, UNG or CD40 genes in autosomal recessive forms. Risk factors: 1. Family history. as HIGM is a genetic disorder. Individuals with family history of the conditions are at a high risk. To gender, the X-link from primarily affects males. Complications: 1. Increased risk of infections, pneumocystic GVC pneumonia, bacterial infections, and gastrointestinal infections are common. 2. Autoimmune disorders. Some patients may develop autoimmune diseases. 3. Chronic diarrhea due to gastrointestinal infections. 4. Liver and gallbladder diseases, including liver failure and sclerosis, cholangitis. 5. Cancer risk. Increased risk for lymphomas and gastrointestinal cancers. Pathophysiology. In HIGM, a deficit in T cell and B cell introduction impairs cell switch recombination, leading to a failure in the production of antibodies other than IgM. CD40L expressed on T cell binds to CD40 on B cells to initiate the class switching processes. Defects in the CD40L are associated signaling pathways disturbs this process, causing impaired immunoresponse and frequent infections. B cell role. In normal cells, B cells produce different classes of immunoglobulins: IgG, IgA, and IgE after receiving signals from T helper cells. T cell introduction in HIGM. T helper cells lack the necessary CD40L expression, which prevents the activation and proper functioning of B cells. Pathophysiology of hyper IgM syndrome. Step-by-step process. 1. Normal immunofunction. 2. Genetic mutation in CD40L or related genes. 3. Defective CD40L introduction. 4. Failure of class switch recombination CSR. 5. Impaired antibody functions. 6. Vulnerability to infections. 7. Additional immuno dysregulation. 8. Chronic infections and secondary complications. In hyper IgM syndrome, a genetic mutation causes defective CD40L introduction between T helper cells and B cells. This prevents cell switching recombination, leading to an overproduction of IgM antibodies and a deficiency in other critical antibodies like IgM, IgA and IgE, the immune system becomes unable to adequately defend against infections, resulting in frequent and severe infections along with potential autoimmune and cancerous complications. Signs and symptoms. 1. Frequent and severe infections, particularly bacterial and opportunistic infections. Fungal pneumonia, example. 2. Failure to thrive in children due to recurrent infections and malnutrition. 3. Chronic diarrhea, often due to gastrointestinal infections. 4. Enlarged lymph nodes and liver. Lymphadenopathy and hepatomegaly. 5. Anemia and other blood disorders. Some patients may exhibit signs of anemia or thrombocytopenia. Diagnosis. 1. Immunoglobulin level testing. Lower levels of IgM, IgA and IgE with elevated or normal IgM. 2. Genetic testing to identify mutations in the CD40L gene or other related genes. 3. Flow cytometry to check CD40L expression on activated T cells. 4. Complete blood count CBC to assess anemia, neutropenia or other blood abnormalities. Nursing diagnosis. 1. Risk for infection related to impaired immunoresponse. 2. Imbalanced nutrition less than body requirements related to chronic infections. 3. Risk for delayed growth and development related to chronic illness in children. 4. Fatigue related to frequent infections and anemia. 5. Impaired tissue integrity related to skin infections. Management. 1. Immunoglobulin replacement therapy. Regular infusions of IgM to provide passive immunity and reduce the risk of infections. 2. Antibiotics. Prophylactic antibiotics to prevent bacterial infections, especially for pneumocystis, gyrobc pneumonia. 3. Hematopoietic stem cell transplantation. Consider curative in some cases, particularly in severe X-linked HIGM. 4. Gene therapy emerging as a potential treatment for creating genetic defects in some forms. 5. Management of autoimmune disorders. Use of immunosuppressive medications as needed. Treatment. 1. Immunoglobulin replacement therapy. 2. Prophylactic antibiotics. 3. Hematopoietic stem cell transplantation. 4. Gene therapy. 5. Management of autoimmune conditions. 6. Treatment of opportunistic infections. 7. Liver and gastrointestinal management. 8. Vaccination. 9. Nutritional support. Psychosocial medicine. 1. Support for families psychological support for families coping with a genetic or chronic illness, to counseling, genetic counseling for families to understand the inheritance, patients, and risk for future pre-genesis. 3. Quality of life. Focus on improving quality of life through infection prevention, nutritional support, and regular follow-ups. Prevention. 1. Genetic counseling for families with history of HIGM to assess the risk of passing on the condition. 2. Infection prevention strategies. Good hygiene, avoiding crowded places, and regular prophylactic antibiotics to prevent infections. 3. Vaccination. Certain live vaccines may be contraindicated, so individualized vaccination plans are necessary. In conclusion, hyper IgM syndrome is a rare genetic disorder that compromises the immune system by impairing antibody production. Early diagnosis, appropriate management with immunoglobulin replacement therapy, and infection prevention strategies are key to improving outcomes for those with severe forms. Stem cell transplantation may provide a cure. Advances in genetic therapies offer hope for future treatments addressing these psychosocial aspects of living with HIGM is equally important for patients and families. Thank you. Have a good day.